As a new reception and placement agency that is also placing and helping refugees resettle in a new area, there have been a lot of lessons learned. There are things that we supposed would happen, and there were other things that didn't quite happen the way that they should. When we've been speaking all through this morning and into this afternoon, we've been talking an awful lot about the social, the cultural, the emotional, the mental aspects of resettlement. In so many ways, a reception and placement agency is involved with some of the very, very physical aspects of resettlement. The things that have to go right in order for some of the other things to go right as well. And we know that it is extremely difficult for someone to begin the healing hope process and moving on in their journey of thriving in a new culture if they don't have some of the very basic physical things in place. It's like saying to someone, you can eat just as soon as you learn how to fish. Somehow or another, in the meantime, somebody has to give a person a fish so they can actually think and get down to the business of actually healing and going on. For us, one of the challenges in this area has been, in fact, housing. There are a lot of requirements around housing. Sometimes it's a little interesting when you look at all the rules and regulations that are around actually supplying housing for whether it be refugees and immigrants or anyone in specific. The rules and regulations around that make it a very, very difficult thing to actually acquire. Number one, we're in an area where there isn't an awful lot of affordable housing. Number two, the rents in this greater Northampton area are very, very high. Number three, some of the families come with multiple children. It is also something that needs to be noted that children under the age of 6, your housing must be lead-free. Many of the homes that were built before 1978 are not lead-free, and you must have lead-free certification. So those are some of the challenges, and yet we know that moving them into that permanent place is a really important idea of, okay, I've established a new home. I've got a place where I can put my permanent belongings. I'm not going from one place to another. I don't feel like I'm still a refugee in my new home. So our goal always is to move the families into permanent housing in the most rapid way that we can. That can take anywhere from 2 weeks to 4 weeks. In a couple of cases, it took actually, well, in one case, it took a little longer. That is something that will be an ongoing challenge. I think it's a challenge that not only we face, but the Department of State faces, as well as many of the other resettlement agencies. The lack of affordable housing throughout, let's say, Massachusetts or other parts of the country really has made it very difficult because of the lack of resources that the Department of State actually puts into the resettlement of refugees. It makes it very difficult to the extent that some of our refugee resettlement places have reduced their numbers and are closed, saying that we simply cannot resettle in this area or that area. And then refugee families have to be moved to other parts of not only the state, but other parts of the United States as well. So that is certainly one of the things that we look to overcome as quickly as possible so that families can get on with their healing and journey towards hope. Healthcare. We're very fortunate, actually. There is the Caring Health Center in Springfield, which is a place where all refugee families that are incoming receive their initial health care services. The Health Care Center in Springfield is under contract, actually, to the Department of State through ORI to provide those medical checks. When refugee families come to the United States, they come with a rather comprehensive medical report. Very, very few times do we have refugees that come in without some kind of physical issue that they are facing. And many do come with positive tuberculosis tests. Many do come with other issues that you would imagine might come from being in circumstances where you do not get the right kind of nutrition. You've been under a great deal of stress, so you see heart conditions, you see diabetes, you see high blood pressure, and other aspects that have to be actually remediated once they arrive here. We also see a lot of back and spinal injury or leg injury. The Caring Health Center does provide the very first of those health checks. From there, they have the option of staying with the Caring Health Center, or in our case, what we have tried to do is bring the families into contact with local healthcare providers. And we've been very fortunate in being able to do so. The healthcare providers, both from Bay State as well as from Cooley Dickinson, have been very forthcoming in helping us to find primary care physicians that really suit the needs of the family. Again, being very careful that we ask the family what kind of physician they want, even the genders of the physicians, and how comfortable they feel actually going to those physicians for the very first time. Do they want accompaniment? What is been their experience with working with healthcare providers in their own context? So from that point of view, we've really got quite a lot that actually Northampton offers us. And we have really not found, actually, at this point, any issues really developing with the provision of health care. I think as we go along, more will be discussed about mental health care and or psychosocial adjustment and perhaps therapy. But again, we are doing that slowly because we need to be aware of what the family's needs really are, how the families and their own cultures view psychological intervention, whether the use of therapists is something that is looked upon as helpful or harmful, or perhaps embarrassing, or somehow something that is taboo in their own culture. So we are not moving quickly with that. We watch, we're available, we're aware, and if people think they see anything that's maybe untoward, we also have access to the mental health group, or what is called the psychosocial working group, who's been very, very forthcoming in simply giving us good advice and giving good advice to the circles of care and helping them be better observers, better listeners, and better advocates in these situations.